Yeah, so it's interesting. A lot of people this time of year get a cold, runny nose. It's so common it has a name for it, right? It's called skier's nose or cold-induced rhinitis. Very common. All it is a runny nose. It's not an infection. It's not a virus, but you may feel like you're wiping your nose every 5 minutes. Cold weather makes your nose run for a few reasons. If you think about it, one of the nose's primary jobs is to keep the air going into your lungs warm and moist. Cold weather is dry, or cold air is dry and cold, so it has to really ramp up that moisture in the nose and the heat in the nose to make it appropriate to get into the lung. This is why your nose runs in the cold weather. It is difficult to tell whether this is an infection or the cold-induced rhinitis. One of the things I pay attention to, however, is the progression. If it keeps on getting worse and worse and worse, and your nose mucus becomes yellow and green phlegm coming out, or maybe you develop a worsening cough, especially if you have fevers and body chills and aches, you should go see a doctor because it may be an infection. But if it's just simply clear, runny nose, about the same, does not getting any better or any worse, this is probably the cold-induced rhinitis and not an acute infection. People with asthma do tend to get it worse, asthma and allergies, because they already have a hyperactive system to these type of insults, so they will get a more aggressive runny nose. So things that you would treat for normal allergies may have some benefit here, such as the antihistamines, the nasal sprays, but really the primary treatment is just keeping a Kleenex with you so you can clean your nose off periodically.